Hi everyone, and welcome to the next set of slides for A&P 1 for massage therapy. I want to continue sort of on the thread we were on the other slide set in terms of standardization of what we're looking at, both macro and micro. So imagine, if you will, that we cut open a human being and in the abdominal region, and we realized that there is a whole lot of stuff in there that we needed to start sort of measuring and looking at, intestine, stomach, spleen, and so forth. What needed to happen was we needed to sort of subdivide that abdominal region, abdominal pelvic region or cavity, and sort of signify what structures we found in each area. So what became of that were what you see here on the slide, abdominal pelvic region. So what came of that is the abdominal pelvic regions and quadrants. What we want to look at now is how that sort of got set up. So when we took at the abdominal pelvic region, we realized it's quite large, and what we did was we started to decide that we needed to divide it into 9 basic regions, and with the umbilicus, or the belly button, at its very center. So within that, we went to 2 transverse and 2 parasagittal lines. Please remember that transverse is running across the body, dividing it into superior and inferior, and the parasagittal lines are away from the very center and are dividing the piece of body that they're cutting into right and left. So fundamentally, the abdominal pelvic regions look like it's cut into a tic-tac-toe set of squares. There are 9 regions. The centermost region is the umbilical region, so imagine the belly button. It is the area that completely surrounds and deep to the umbilicus. The next region is above the square, directly above the umbilical region, is called the Epigastric Region. Now remember that in terminology, epi means around, gastric means stomach, so imagine an area around the stomach above the umbilical region. The Hypogastric region, or also known as the pubic region, is located inferior to the umbilical region. Hypogastric, meaning hypo meaning below. So we have the epigastric region around the belly button. We have the umbilical region around the belly button. We have the epigastric region above the umbilical region, and we have the hypogastric region below the umbilical region. We then have right and left iliac or inguinal regions, and these are located lateral to the hypogastric region. So imagine that you have this hypogastric region, or this square below the umbilical, and to the right and left of that, 2 other squares, which are the right and left iliac or inguinal regions. The reason for the dual name is the iliac bone is in there as well, and also the area within this iliac region contains the inguinal ligaments, which are related to abdominal structures, and so therefore it has the 2 names, either the right and left iliac or the inguinal regions. As we work our way down, we have the right and left lumbar regions that lie lateral to the umbilical region. So right and left iliac are either side of the hypogastric, and then the right and left lumbar regions lie lateral to the umbilical region, sort of coinciding with the lumbar region of the back in a posterior aspect. And then if we go all the way to the top to the epigastric region that's located above the umbilical region, to either side of this epigastric region are the right and the left hypochondriac regions. Okay, the reason it's called that is, a lot of you are thinking, some kind of mental illness thing. Chondri actually means rib. So the hypochondriac region means the regions below the rib cage. So we see here in the diagrams, here is the umbilical region here in the center. We have the right and the left lumbar on either side. We have the epigastric region above the umbilical with the right and left hypochondrium or hypochondriac, either or. Again, the umbilical region directly below is the hypogastrium or the hypogastric region, and on either side of the hypogastric region are the left and the right iliac regions. One of the key points you need to take away is that when we're thinking of right and left, it's not the right and left of you looking at that body. It is the right and left of that body itself. This is the reason why In these diagrams, right and left seem backwards because you're thinking of it on the physical body, not from you viewing it or looking at it. So just as a review, umbilical region is in the center. Epigastric is superior to the umbilical region. Hypogastrium or hypogastric is inferior to the umbilical region. On either side of the hypogastric region, we have the left and the right iliac or inguinal regions. Directly right or left of the central umbilical region are the left and the right lumbar. We then have the epigastric region that lies superior to the umbilical, and directly either side, left and right, we have the left and the right hypochondrium or hypochondriac regions. Now, when we look at regions versus quadrants, it's exactly quadrant meaning exactly what you think it does. It's something that's divided into four. Quad meaning four. So where there was two transverse and two parasagittal planes in the regions, in the abdominal pelvic quadrant, there is one transverse and one median sagittal plane, and they bisect right at the umbilicus. So both the transverse and the median sagittal planes pass through the umbilicus at right angles, dividing the abdominal pelvic region into four areas. And they are named according to the position from the subject's point of view. The right upper quadrant, the left upper quadrant, the right lower quadrant, and the left lower quadrant. So we see here, we have, again, it seems backwards because we're referencing it from the patient's perspective. We have the right upper quadrant here, the left upper quadrant here, the left lower, and the right lower. Please take note of some of the organs that we do find in these areas. Of key notice in the right upper is the right lobe of the liver and the gallbladder. On the left is the left lobe of the liver. Yes, the liver actually is a very large organ and does cross across this mid-sagittal plane. We find the stomach, the pancreas, and the spleen in the left upper. In the right lower, we find the appendix, if any of you have had your appendix removed or know someone that does. We do find some of the reproductive organs. We find the right ovary in the female and the right spermatic cord in the male. In the left lower, we find most of the small intestine, portions of the large. We do find reproductive organs here as well, the left ovary in the female and the left spermatic cord in the male. I only will be looking at the ones that I just listed in terms of any kind of quiz or something that I have. Thank you and for your time, and we'll see you in class.